For decades, we have known the benefits of a healthy lifestyle, and for decades, people seem to have been ignoring that. Change comes very slowly. I mean, CVD is still the #1 cause of death, 787,000 here in the US alone, already leading the world in per capita healthcare expenditures. US medical costs related to CVD are projected to triple by 2030 to more than $800 billion annually. So let's go to the August 25th issue of JACC, please. Time to change our focus, defining, promoting, and impacting cardiovascular population health. And I'm with Dr. Laurence Sperling, who is a professor of medicine and director of the Center for Heart Disease Prevention at Emory University School of Medicine, correct?
That's correct.
And time to change our focus, I guess. I mean, it's not working. We got to change something. What can we change and how do we change it?
Certainly. I think this is an important paper to highlight to the cardiologists in America and those who are focused on cardiovascular care that our traditional healthcare model as it is not that successful. We are focused predominantly on detection of disease, often very late in the disease process, and then trying to go back and fix something that's often been going on for a decade or decades. This is a very costly way to deliver health care. And by the way, it is health care, it's really not disease management. So we should think of the term health care as a focus on health promotion and disease prevention. Traditionally in cardiology, we are focused on doing something once the heart is broken. And it could be broken in the arteries, the muscle, the electrical system, etc. Our paper focuses that it's time to change our perspective. We need to focus on cardiovascular health and not cardiovascular disease, and really start thinking about it on a population health level.
Now, one of the great success stories seems to be taxing cigarettes, taxing tobacco. That seems to have done a tremendous job in helping reduce the number of people who smoke, at least. Is that the kind of thing you're talking about?
Well, certainly, as we look at a new paradigm in terms of healthcare delivery, and by the way, it's coming. By 2018, it is thought that 50% of our healthcare reimbursement models will be of a different form, likely leaning towards accountable care organizations.
Right.
And so if we look at how do we approach focusing on health and not disease, there are many different ways to do this. I do think we can do it within the healthcare system itself, but we need partners. Partners include government, public policy, public health, and really not only in our country where we're looked at as a model of success, but other places around the globe, taxation appears to be a very successful part of the strategy to get people to reduce their smoking behaviors.
Does it help to have doctors say, please stop smoking, let's talk about it, are you ready, shall we enter you in a program? How can doctors enter into the picture at that point?
Yeah, physicians can enter into the picture of effective tobacco cessation with each of their patients, and I do think there is strong evidence that a physician message and a frequent physician message with their patient is a good place to emphasize a change in smoking. The physician should assess the patient's readiness to change, though, but have a strong message and a strong partnership with that patient about creating a plan for tobacco cessation. Now, physicians can have other roles in tobacco cessation in their communities and also as advocates. And I know the American College of Cardiology has had a strong role in advocacy, trying to impact factors like tobacco use in our country.
Now, in this paper, which is in the August 25th issue of JACC, what else do you suggest in terms of trying to change our focus?
Yeah, our paper looks at really three areas. One is defining health. Before we change health and health behaviors, we need to understand what it means to be healthy. And here we did focus on the American Heart Association definition of the Simple Seven. And the Simple Seven, if you're not aware of it, is 7 factors that really should be at ideal levels to define cardiovascular health in addition to absence of cardiovascular disease. So that's ideal weight, ideal dietary patterns, regular physical activity, non-smoking, and then optimal levels of blood glucose, blood pressure, and cholesterol. Now, if we look at the paradox, unfortunately in our country, which by the way, spends more than any other country in the world on health care. Now over 18% of our GDP, which is not sustainable, and it's our biggest challenge right now as we move towards the future in a global economy. But if we look at the percentage of Americans that have ideal cardiovascular health, there's a study from the CDC looking at over 350,000 Americans, a behavioral risk factor surveillance survey, and by definition of ideal health, only about 3% of Americans have ideal cardiovascular health.
Right.
So defining health, I think, is a start. We want to focus on promoting cardiovascular health through many different avenues, and that means our healthcare system, but government, public policy, our schools, our workplaces, media, through our communities. We need these partnerships to really be successful in reducing the rates of cardiovascular disease and risk factors. And lastly, it would be impacting cardiovascular health. And impacting cardiovascular health really is looking at metrics and changing the way we deliver what we do in healthcare. Right now, we have a model where patients come to the office, or we wait for them in the hospital when they come to the emergency room with a myocardial infarction. Really, we need to learn how to go out to the communities. We can find communities that are the highest risk communities in our states, and these are very well-known data. They've been stable for a long period of time, and I make the point that your zip code is likely a more potent risk factor for cardiovascular disease than your genetic code. And we need to understand that most health and most risk for disease is very local. It has to do with social determinants of health. Your environment not only is an individual, but your environment surrounding you. Is there walkability, access to fruits and vegetables? Is there access to healthcare? These are important factors that we need to understand better and start to impact.
Well, in your paper in JACC, you also cite in an era of limited resources, you talk about a paper a few years back from the World Health Organization stating that fully 1/2 of the WHO's best buys for health are related to smoking cessation, dietary changes, or increases in physical activity. If you want to have the biggest bang for your buck, that's where physicians may want to put some effort to getting the patients to stop smoking, change their diet, and increase physical activity.
Yeah, most certainly the concept of best buys is an important one, because in an ideal world we'd have totally unlimited resources, but that is not the case. And so if we focus on population attributable risk, the two areas that we should focus on are smoking and then lifestyle and behavioral factors, as you mentioned, fruits, vegetables, a healthy dietary pattern, and physical activity. And right there, we're looking at a large portion of population attributable risk for cardiovascular diseases.
Well, if you want to see Dr. Sperling's paper, please check out the August 25th issue of JACC. And we have a lot of material also online from this meeting at ESC and elsewhere. Please check that out. For CardioSource World News, I'm Executive Editor Rick McGuire.